One of the most common requests we get is for treatment of back pain. And considering up to 80% of Australians will experience back pain at some point in their lives, and 10% will experience a significant disability as a result of that back pain, it's pretty clear why we need the sanakey to help us have sustained pain relief. And back pain disrupts individuals' quality of life and accounts for an enormous cost to the community. So following a few of these steps, you're going to go a great way to relieving your back pain. Now, in your manuals that you would have received with your sanakey device, you would see there the 3 pathways. Now, I'm going to show you a couple of different ways of treating the spine. First, when you have someone to treat you, which is always a great thing because it's a very invigorating treatment and a very health promoting treatment. And this is called the 3 pathways, and we use this for pain related to the spine. So even if you just have a lower back pain, you can always use this treatment. Now, the whole idea is you're going to go down the spine and then either side of the spine, approximately 2 to 3 centimeters either side of the spine. It's not a arbitrary measure. It just depends on how your spine is. If you've got a little curved spine, you need to follow the spine. Now, what you're going to do in this treatment is you're going to slide the sanakey down the spine slowly, looking for key points, which are stickiness, color of the skin, sensation of the device for your patient, and of course the sound of the device, the clacking sound it makes as it's going along the skin. What you'll often find in an area that needs treatment is the device will go quiet, and that's where you have to stop and use your 4-direction treatment. Now, in this, I'm assuming you are a little bit au fait with all your settings, so you're going to use the settings according to the pain. So if it's an acute pain, you might want to use sedation. If there's a lot of stress involved, you might want to use sedation as well. If it's a chronic problem, try a combination of activation and harmonization. So what I'm going to show you now is a little treatment that I've done on a client, and I'm going to show you how we would treat normally in the clinic. One important thing to note is I'll have the patient lying down, sitting up if they want, and the arms up around the head so I get a nice straight spine. What we need to do then is we're going to have to select our setting, and it really doesn't matter if you just select basic, it's okay, and this is what I've done here. And then an important thing, we need to select the energy level, and what I'm going to do there is I'm going to put the device on either side of the neck, and I'm going to get a level that is comfortable. Now, you are not to hurt anyone with this device, so generally in the clinic we'll say comfortably uncomfortable, so you feel the impulse but it's not painful. And then I'll always go down to the lower back and make sure they can feel it. Now, as you can see me showing here, I'm going to actually go down the spine from the top of the head. And so I'm going to hold the device there, and I'm going to slowly drag the device along down the spine. Now, what you're looking for as you go down the spine are sticky points, taking note of them, because what we're going to do, if you've read the instructions in your manuals, we're going to do this a number of times, 3 or 4 times. And you can see I can easily go under the bra strap there and straight under, and it doesn't matter which way you hold the device as long as you have skin contact and you're dragging the device down. And as you can see at the top in between the shoulder blades, there's a little bit of redness already. The energy level's nice and comfortable, and this gives me an idea of where I'm probably going to find sticky spots. So I'm doing that again, looking for those sticky points. There's one there, as you can see. Now I can choose to keep going, or as I do now, I'm going to brush it in 4 directions, looking for the stickiness. And as you can see, I'm just concentrating on that small area to brush that stickiness out. And I'm going all the way down again. I've done it twice. I'm going to do it 3 times, maybe 4 if I need to. It doesn't matter how many times you actually treat the spine as long as you find those sticky spots. And I'll always try and do one final run down the spine to make sure it's all clear, and you can see me doing it there. So I'm actually 4 times down the spine, going underneath that bra. It doesn't matter if you lose skin contact and start again. The whole idea is to treat the spine. So once I've done that, I'm going to treat my left pathway, which is actually what we call the left paravertebral, and I'm going to go down there, and as you can see, I'm just dragging the device along. Doesn't matter how you hold the device, as long as you hold it firmly on the skin so you're getting constant contact of the electrode. Don't worry if you have to adjust the energy level. If the patient says to you, or your partner says to you, sorry, that it's a little bit too much, you can always turn down. It really doesn't matter. Very simple to do. You can do this once a week, twice a week on each other. It's going to be a great way of regulating your nervous system, as well as giving you really good pain relief if you have a spinal pain. As you can see, I'm just working on that left paravertebral, brushing in those 4 directions. Don't forget, those 4 directions are specific so you can actually get into a routine of finding different directions of resistance. Remember, you always treat the direction of most resistance to clear it, and once you've cleared it, that's enough. You've stimulated the body, and then you just move on. So I'm doing the final pathway now, and it's not a long treatment. It's a quick treatment. Obviously, if you have stubborn sticky spots, remember, go back to your original videos that I've done on the actual settings, that you change the settings. If you don't get the results, that scan, treat, assess. If you don't get the change you want, you simply change your setting and you do the thing again. All right. So that's the 3 pathways. Now, another way I want to show you is, if you can't treat yourself, a wonderful way to treat yourself is the pads and leads for self-treatment. And what you need for that is the electrode head attachment for your sanakey device. And it's simply using 2 of those 5x9 pads. They're the electrode pads that we sell with the device. Put one just under C7 at the top of the spine there, and another one at the base of the spine. And all you have to do then is connect the electrodes lead up. Doesn't matter which way the electrode goes into the actual pads, just be sure you put the actual electrode head on firmly on your device. Connect each lead up to the respective electrode. As I was saying, red or black, it doesn't matter which way it goes. And simply turn your device on, and you can run that for 20 to 30 minute treatment. It's very relaxing. Remember, don't have it too strong and hurt yourself. The whole idea of this, you're meant to enjoy your treatment. So that's a way that I will often finish a treatment for 10 to 15 minutes, letting the patient lie there. Or when you're treating yourself and you can't treat your whole spine, that's a great way to do it. Another way of treating is, when we do local treatment, it's often hard to reach behind and treat yourself. Obviously, some of you will be able to do that, but also just remember that sometimes you can't get there. Even though the electrode head is a good length to be able to reach that, you can see that sometimes if you're not quite dexterous with the device, it's not as easy to find that sticky spot, but there is a way to do that. And once again, to do that, you're going to need the leads and electrode head. And all you're going to do there is you're going to put the electrode leads on each side of the spine. So I'm assuming here in this patient, they've got lower back pain that spreads out either side of the spine. So just sticking that electrode either side of the spine, you adjust your energy, select your setting, and let it run for 20 minutes, 30 minutes, more if you need to. If you are in pain, you can do it longer. So there's a little example of different ways to treat spine and lower back pain. Don't forget, use your sanakey, use it often, because it's a great way of keeping you pain-free and healthy.